Okay, so feline cardiomyopathies are the most important type of feline heart disease. So when we think about canine heart disease, mitral valve disease is by far the most common. We see that in sort of older small breed dogs. We do see dilated cardiomyopathy, but it's nowhere near as common as mitral valve disease. Now in cats, they rarely get myxomatous valve disease. So we're really talking about heart muscle disease as a sort of acquired form of heart disease in cats. We do see congenital heart disease, but it's relatively rare. So we'll talk about that a little bit later on, but not in a huge amount of detail because you're really not going to see much of it in practice. And so to spend a lot of time talking about it takes away time from talking about things that you will see. So we classify feline heart disease in these different classifications, and basically these are echo classifications. And ultimately, when we're talking about the way we classify feline heart disease and the way we treat it, the purpose of the classifications is so you understand the pathophysiology. Okay, that's really all the classification is there for. It's to try to understand, is this a thickened heart that's contracting okay but not relaxing properly, and therefore we'll target our therapy appropriately for that, or is this a heart that's dilated so it's not contracting well so it needs systolic support, or is this a heart on echo that looks like a bit of everything? You know, some of these cats have a bit of thickening, a bit of dilation. You know, they don't fit comfortably into any particular category. We have other forms such as restrictive cardiomyopathy, which we're not sure whether that is a category in itself or is it an end-stage hypertrophic cardiomyopathy. Because remember, often these cats, we don't get to track them serially like probably happens more in human medicine. We see them as you said, they tend to be, you know, arriving, either you pick them up when they're asymptomatic because of a murmur, or they're arriving in extremis, maybe without any auscultatable signs, and then we see an end-stage form of disease and we don't know what that was months, years before, and so that is a limitation. But these classifications are really based on human classifications, and I think it's important to be aware of arrhythmogenic right ventricular cardiomyopathy, which we do see in cats as well. Now you may have heard of this in dogs, we see it in boxers, and we call it a cardiomyopathy, but often these boxer dogs with it don't have a big dilated heart. And that's slightly different from the cats. Often, and I'll show you some examples of a cat with ARVC, they tend to have dilated right hearts. But the characteristic of this type of cardiomyopathy is the arrhythmias that come with it, as obviously it alludes to in the name. But I don't want you to get too hung up on the classifications. They're really there to guide you in terms of how you're going to treat them, and we'll pull that together as we go through. What is very important, and really this is primarily for hypertrophic, because this is by far the most kind of common heart disease that you'll see in cats. We have the other classifications, but you're going to see HCM most of the time. So what we need to decide is it primary, so what we mean by that is likely genetic HCM, or is it going to be secondary? And obviously secondary just means secondary to systemic disease that is causing increased afterload or increased pressure on the left ventricle, and therefore, a bit like going to the gym, if the left ventricle is having to work harder, it will get thicker. But on an ultrasound, you can't tell just by looking at that, is that primary HCM or is that secondary HCM? And that's why it's so important to do our diagnostic workup to rule out systemic disease. If we rule those things out, then often the genetic or primary HCM is almost a diagnosis of exclusion. We've ruled everything else out, so it's most likely to be that. So if we start with HCM, or hypertrophic cardiomyopathy, the hallmarks of this, and as I said, it is an echo diagnosis really, but it's a thickened left ventricular walls, and the chamber is not dilated. Okay, so it's often a normal to small chamber size, and the reason it can be small is as the heart muscle gets thicker, it tends to get thicker in the ways, if that makes sense, so the chamber can get smaller as a result. And some of these cats have very small chambers, and their papillary muscles get really, really big, and as the heart contracts, they almost get obliteration of the chamber. As the heart contracts, they get something called end systolic cavity obliteration, where the papillary muscles are literally filling the ventricle as it starts to contract. But for it to be primary HCM, it has to be in the absence of other cardiac disease and other systemic disease. And the cardiac disease that could cause increased afterload or increased pressure on the left ventricle will be anything that makes it harder for the left ventricle to push blood into the systemic circulation. So that could be aortic stenosis, which would be a congenital defect. we don't see it commonly in cats, but if it was a young cat presenting with HCM, let's say it's a cat around a year old, we do see HCM in very young cats, but you definitely want to rule out that there isn't aortic stenosis. Again, that would be an echo diagnosis. The cat would have a loud murmur if it had enough aortic stenosis to cause thickening of the left ventricle. And in cats, we can see both subvalvular aortic lesions, so it's a stricture below the aortic valve, as well as valvular aortic stenosis. In dogs, we tend to see subvalvular. We don't see very much valvular, but in cats, you definitely can see both.